My interest, my passion has been preventative cardiology. Heart disease, cardiovascular disease, or as I call it, plaque, kills roughly 50% of us. But the problem is that this disease starts in our teenage years. And it festers, and it grows, and it develops, almost like a cancer. In fact, sometimes I call this problem cancer of the coronaries. It's a subtle issue, but when plaque forms, you've got the channel, you've got the tube, but this plaque always forms outside initially. And if I have a tool where I can see the channel, the tube, the hose, but I can't see out here, I can say you're normal and miss the plaque. By the time you have a severe plaque, then that plaque is growing into the vessel, it's causing a narrowing, and when you have about a 70% narrowing, that's when you start having symptoms. Most people with heart disease, when they manifest the first symptoms of heart disease, of heart problems, their first symptoms in about half of the men and 2/3 of the women is when it kills them. Which is why this new technology called CT angiography is such a tremendous advance. Basically, we use a very sophisticated, highly sophisticated, unique kind of a CAT scanner, just a big donut, and in this donut, with all its very sophisticated hardware and software, that's where we take the pictures. So the whole process generally takes about 10 minutes on the table, 10 seconds to actually take the pictures, and in that 10 seconds we get over 3,000 slices through the heart, very thin, very quickly, and we can then use that information, and really what we're doing is creating a three-dimensional inside picture of you. And with this information, on our three-dimensional display stations, I can literally look at your heart, take your heart out, turn it, spin it, slice it, dice it, fly down the blood vessels, look at the heart as it's beating, look at the heart valves, and beyond all that, I mean, that's the main purpose and goal here, but we get a lot of other additional information. We can look at the lungs, we can look at your spine, we can look at your liver, your stomach, make sure you don't have hiatal hernias, all of those conditions, no pneumonias. We diagnose about 1 or 2 people a month coming in for a heart scan with early lung cancer. Early lung cancer is incredibly curable. It's late lung cancer that kills people, just like late heart disease is what kills us. This allows us to now see what we've never been able to see before, to allow us to understand, do you have this condition or not? It's a 10 or 15 minute investment in time that can save your life. And just like there's that commercial that says 15 minutes can save you hundreds of dollars, well, here's 15 minutes that can literally save your life. Imagine you could do something where you could eliminate 50% of the mortality of the people in your community. And that's what wakes me up every day and gets me excited. Every day I have the honor and the pleasure of helping people. And that's my goal, that's my profession, that's my calling.